A Roman citizen lifts a small vial to his lips, not filled with wine or water, but with urine. He swishes it around his mouth, spits, and smiles, believing he has just cleaned and whitened his teeth. Near modern sensibilities it is revolting, but to the Romans, it was medicine.
Ow.
This practice was part of what is now known as urine therapy. The use of human or animal urine as a treatment for various ailments, from dental hygiene to life-threatening illness. Its history spans centuries and continents, a testament to human desperation and ingenuity in the search for healing. In ancient Rome, urine was a valuable commodity. Collected in jars on street corners, it was used in tanning, leather, bleaching clothes, and even whitening teeth. Physicians like Pliny the Elder and later writers noted its supposed cleansing and medicinal properties. The chemical basis, though unknown at the time, lies in ammonia and other compounds that can act as cleaning agents. To Romans, this made urine practical, if unpleasant, as a dental rinse. Wealthy citizens paid for imported urine from Portugal, considered especially potent, and poets even mocked the habit in satirical verse. But Rome was not unique. Across cultures, urine appeared in medical texts as a diagnostic tool and as a treatment. Ancient Indian Ayurvedic medicine described urine therapy, called Shivambu Kalpa, as a way to purify the body and spirit. Medieval European manuscripts included recipes involving urine for wounds, infections, and even cosmetic purposes. In early modern times, alchemists experimented with urine as a source of salts and phosphorus, blurring the line between chemistry and folk remedies. Drinking urine was perhaps the most extreme form of the practice. Advocates claimed it could cure everything from snake bites to epilepsy, and in later centuries, some even promoted it as a cancer remedy. The belief persisted well into the 20th century, with fringe movements advocating urine consumption as a universal cure. During wartime, or in survival situations, soldiers were sometimes told to use urine to clean wounds or soothe jellyfish stings, reinforcing its reputation as a last resort remedy. The endurance of urine therapy reveals much about the history of medicine. In eras when antibiotics, antiseptics, or even clean water were unavailable, people turned to whatever seemed to work. The body's own fluids, seen as natural and divinely provided, offered a kind of circular logic. If the body produced it, perhaps it was meant to heal the body too. Symbolism and practicality often combined, making the bizarre seem rational. Of course, modern science rejects urine therapy as ineffective or harmful, except in the rarest survival circumstances. While ammonia and urea do have some chemical uses, the risks of infection and toxicity outweigh any potential benefits. Yet the fascination endures, with occasional fringe groups or wellness advocates reviving the practice, often invoking ancient authority as justification. The Roman pea mouthwash may strike us as grotesque, but it fits into a larger human story. The constant search for cures in a world of pain and uncertainty. What today feels absurd was once serious medicine, practiced in good faith by those who had little else. Every gargle, every sip, was part of an experiment across centuries, a reminder of how far people will go in the name of health, and how often desperation turns the unacceptable into the acceptable.